healthcare costs, quality of care, emerging diseases. All challenges facing the health community. But there is an even more insidious challenge inhibiting how we as healthcare providers, and indeed how American society in general, meet the needs of our patients. We call it low health literacy. Hundreds of studies indicate that health-related materials such as consent forms, written instructions, and information on pharmaceutical drugs, both prescription and over-the-counter, are written at levels well above the average reading ability of American adults. The Institute of Medicine report shows that roughly 90 million adults in America may lack the functional reading and math skills to effectively use the U.S. health system. Most are native-born English speakers.
Half an hour later, I took another one, and then an hour later, I took another one. I kept taking them. On the bottle, it says, take one when you needed it.
Sometimes the doctors and pharmacists use the type of the words that, that sometimes it's hard. They be using those fine words, those college words. It's hard for people like me to understand.
Don't ask me. He puts me on there, and I just take it.
How could I be so stupid as to allow somebody to take part in my body, and I didn't know it?
Health literacy is about finding, understanding, and using health information and services. For patients, it requires reading, writing, and calculating basic math, the tools necessary to participate in their own health care. For physicians, it means learning to listen, speaking clearly, and bridging cultural barriers that cause misunderstanding and mistakes. We know that among those most likely to face limited health literacy today are the elderly, the poor, and new immigrants. Limited health literacy contributes to the ever-increasing health disparities in our country. We also have evidence that adults with limited health literacy often fail to manage their own disease, report poorer health, and are less likely to use preventative services. Two recent studies report that Americans with poor health literacy use the emergency room and hospital services more than other Americans, which contributes to increasing healthcare costs. As the healthcare system grows increasingly complex and sources of competing and often conflicting health information grow, poor health literacy becomes a systemic problem for almost all Americans. Health literacy is not only the responsibility of a patient or family member. Healthcare providers, the public health communities, government, health communication advocates, advertisers, and marketers each must take responsibility. And action. View the full IOM video and the written IOM report, Health Literacy, A Prescription to End Confusion. We need your help and support to address this challenge.